So in the practical session today, we will look at all of the new steps required for applying study data management in RevMan. And you can move on to the next slide, please. In the previous webinar, we walked through this process slide in detail. But today, what we'll do is we'll dive into all of these green parts and look at how to do it practically. So that means defining review criteria and setting up synthesis PICOs in the planning step. It means we'll look at how templates based on the review criteria and synthesis PICOs could look like in the preparation step. And finally, we'll look at how a completed data set can be imported directly into RevMan, and how then the analysis setup are populated automatically in the populate step. Thanks. In this showcase, we'll look at a research question which is based on an existing Cochrane intervention review, vitamin D for the management of asthma. The showcase that we have is basically based on the practical exercise that you can access in the Study-Centric Data Hub or portal, and with a few additions. So you will get to see a few more features today. And before we move on to showing the process in RevMan, because I'll be demoing how to do things in RevMan, we'll have a short walkthrough of what the review criteria will be and what types of analysis we want to plan. And basically, this is the process that Rachel has been talking about. So to have this ready before you go into RevMan is a good idea. So first of all, in this review, we are looking first at a quite broad synthesis question where the population is participants with asthma. And the experimental intervention is vitamin D any type versus placebo any type. And we're interested in the outcome, one or more exacerbations. You can just move on. I think there's a brief explanation of exacerbation here. And so this is an outcome that will be defined as dichotomous. And this will be the core synthesis that we'll then adjust in different ways, looking at more narrow synthesis questions. And so the second analysis is not looking at any vitamin D, but a specific one. And so all of the other PICO parts are the same. You can move on to the next. And third, we're doing a sensitivity analysis where we're again looking at the broader question, any vitamin D versus placebo, and it's the same outcome. But here we're actually using a covariate to exclude values where the daily dose is smaller than or equal to 2000. And in the fourth analysis, we're doing a subgroup analysis. So again, we're looking at any vitamin D versus placebo and the same outcome. But here we're actually going to subgroup by the daily dose, so the covariate daily dose. So having this in place, we're actually ready to move into RevMan. And so let me just share my screen so you can follow along. There we go. Can you see my screen now with RevMan?
Yes.
Great. So like I said before, this showcases an extended version of the practical exercise. So that means that after this webinar, hopefully you can go and try this out yourself and replicate some of the analysis that we've been setting up in this webinar. So I have created a practice review and I've navigated into it. And on the dashboard, you can see that study-centric data is enabled in 3 different ways. So you can see that on the status panel, there's a study-centric data indicator. there is a button to import study data, and there's also a new item in the left-hand navigation called Review Criteria. And so since we have now done a brief plan of the analysis, the first step in RevMan is to define the review criteria. So we'll navigate to this new section, and here you can see the intervention tab. So this tab is where you will be describing all the granular interventions when you want to do narrower analysis. So for example, if you want to compare a specific type of vitamin D with placebo, like we're doing in analysis 2. In this example, we've already added the control interventions and the experimental interventions here. And so note that you are expected to add both control and experimental interventions on the same screen. If we then move on to intervention groupings, you can see that I've added an intervention grouping, which is called vitamin D any form versus placebo. So this is looking at the wider, broader synthesis question. And we have added 2 intervention groups in that grouping. So one is placebo and one is vitamin D. And so important to note here is that you can only add one intervention in one of the groups. So it can only exist in one of the groups. If we move on to the Outcomes tab, you will see that we have here defined 3 different outcomes. In the analysis that we're looking at today, we're only looking at 1 or more exacerbations, which is a dichotomous outcome. But as you can see, you can also add continuous outcomes. And moving on to the, and I should also note, so Rachel made a good point about saying that it's important to consider your time points. So if you are adding, if you want to do analysis for different time points, you will be adding 1 time point. So 1 outcome for each time point. So that's important to note. In the covariates tab, you can add covariates that you want to use to investigate sensitivity or to subgroup by. And you just give the covariate a name, and then you can add the covariate categories. So you can see here in this review, we're looking at daily dose with 2 different categories. You can see there are 2 tabs here, characteristics and risk of bias. These are basically set up for your reviews, for what characteristics and risk of bias domains you'll have. So normally you don't need to edit any of these. So that now you've seen the review criteria set up. So what we're going to move on to next is setting up the synthesis PICOs. So that means actually creating the analysis already. So I will add an analysis group. I will just call it vitamin D versus placebo. And moving back to the analysis, I can then add a new analysis. And so you will, with study-centric data, you will get this option to choose study data as input method. And so that's what we're expecting for all of the analysis today. However, if you want to use the custom input for, which is the old style of entering data directly into the analysis, you can still do that, and then you'll pick the custom input. And there are some types of analysis where this may be relevant, but the knowledge base articles for RevMan explains pretty well which these examples may be. So for now, we'll create a study data analysis. And before we're selecting the synthesis PICO, which is what tells RevMan which data to pull in, we also need to decide which type of data we want to include. So this is the data source. And as you can see, we have 4 different options: arm level data, contrast level data, or both with a different preference. And so these are actually new concepts that we have introduced in RevMan to improve the process of creating what was formerly called GIV analysis. So analysis where at least some of the data is contrast data. So I'll give just a brief explanation. Contrast level data is when only effect estimates for comparing the intervention arms are available. So for example, mean difference or adjusted odds ratio and hazard ratios. And arm level data is when data for all study intervention arms are available, such as the number of cases or events for each arm or mean effect sizes for each arm. So I know these concepts can be new for you. So I also want to, I think we'll pop into the chat a link to a knowledge base page that explains this terminology as well. So you can have a look at it in more detail. But for this analysis, we're going to pick contrast and arm level data, which means that if both exist, RevMan will actually generate contrast data from the arm level data automatically. But we'll get to that a bit later. So now it's time to define your synthesis PICO. And so what you're really doing is telling RevMan which data should be pulled into this analysis. So here, looking at the analysis we had defined in the PowerPoint slides, where we want to select one or more exacerbations. That was the outcome we were interested in. And the first analysis was a broad analysis. So what we're doing is we're using the intervention grouping. So here we say we use this grouping, vitamin D any form versus placebo, and that updates the options here in the experimental intervention and control intervention drop-downs. So we can now choose vitamin D any form and placebo. And so this is basically our synthesis PICO for this analysis. And so, of course, as a next step, you would also set up your statistical methods, but since these aren't really changing in comparison to RevMan before, I'm not going to make any adjustments. So I will just see if I can add a name to the analysis so we can get back to it later. So I will give it one or more exacerbations and then any vitamin D as a name. And then we can move on to defining the synthesis PICO for analysis 2. So again, we'll add a study data. I'm picking the same option here for the data source and the same outcome. But now, instead of picking the intervention grouping, because this analysis wants to look at a narrower question, which is a specific vitamin D versus placebo, we're picking that intervention here and then picking the placebo. So this is now the synthesis PICO for analysis 2. And let's see if I can give this one a suitable name as well. Great. And we'll add the third analysis where we are looking at the same outcome still. And now we're looking at the broader question again. So we'll pick intervention grouping, vitamin D any form, and placebo. But we are now interested in filtering out some of the values. So we said we wanted to exclude results where the daily dose is less than or equal to 2,000. So what we'll do is we'll pick the covariate to filter by daily dose, and then we'll say exclude and exclude and choose the category value. And so that's the synthesis PICO for analysis 3. And let's just give it a name so that we can find it easily. Now we go back and create the final analysis here. And again, we are looking at contrast and arm level data. We are looking at the same outcome. We are looking at the broad analysis, so we pick the intervention grouping. And now what we want to do is we want to subgroup by the covariate. So then we can choose this subgroup by covariate, and then you pick daily dose, and that's basically what you do. And so for all of these analyses, you'll see, I'm just going to give this one a name as well. For all of these, when you've set up your synthesis PICOs, you can still go to the graphs tab, but you'll see that there are no results included. But since this is subgroup, you can actually see which subgroups will exist. But for now, there's no data in the review. So none of the analysis have any data. And as you can see in the included studies, there are no studies. So at this point, when you basically have a clear plan for your analysis, you have set up your review criteria, you have defined your synthesis PICOs in RevMan. This is a good starting point for designing your data extraction template, because at this point, you really know which data to extract. And like Rachel said, hopefully that will save you a lot of time. And in the RevMan Web Knowledge Base, you'll find templates that will guide you to structure the data in a way that you can import them directly into RevMan. So these templates can actually be used as a starting point together with the synthesis PICOs to help you design your data extraction sheets. For today's session, we have prepared a data set, and I will start sharing those and just walk you through how that can look like. So the first file that I'm showing you, so you can see this is an Excel file, but it's actually saved as CSV. So that's really important because CSV is the format that RevMan can handle. And this sheet is called the study information sheet, and it has information about the studies. It could have information about the study characteristics. In this data set, there's nothing there yet, but what you can see is that we have actually added categories for the covariate that we have defined for our analysis. And the next sheet that I will share is which arms the studies report. And that sheet looks like this. So that basically has the studies and the arms. You can enter descriptions and import them if you want to. Also, if you only define the arms, the interventions will be automatically populated on import. But this is the arm sheet. And finally, I will share the most exciting one, which has the result data. Great. Okay, so this sheet, as you can see, is a bit more complex because this is basically the root of all your analysis. Here, you can see we have the studies again. Each row is an arm result. So we have the outcome defined, what type of data it is. If it's contrast data, it will show the effect measure, and you'll always be defining the arms. If it's contrast data again, you'll have a reference arm or not, and then you have the actual data added. So if you make sure that you extract your data and structure it in this way, like the 3 sheets I've shown you now, you'll be able to import into RevMan, assuming that you've set up the review criteria. So let me go back into RevMan and show you how you can then import your all your data. So you go to the dashboard, you click import study data, and now we're interested in importing from template, and you pick the files that are relevant here with all the data that is saved in CSV and has the correct format that RevMan expects as defined in the templates. So I will pick study information. You can see that RevMan actually checks your files, and here it says no errors found, so that's great. I'll continue and upload the arms. Again, no errors, that's great. And finally, the results. And since there are no errors, we are okay to go and import the study data. So I will just do that. And with that, we have created a few new studies and added data to them. So we can see here, if we go to the included studies, you'll see a list of studies, and looking at them, you can see that we have study arms, result data, and covariates all imported in a very short period of time. So that's exciting, but let's go to the analysis and see at what's really great, because we've previously told RevMan which data to pull in. It actually knows now what results will match them. So we go to the Graphs tab and see that here there's an analysis. Very exciting. And so this is really quite spectacular to be able to see the analysis populated so quickly after all the hard work. And you'll also see in the results here that some results have more decimals, and that is likely because RevMan has automatically generated contrast data from ARM data, or it has combined arms where relevant. But I think this data set doesn't have any studies that have more than 2 arms. But we can actually see this in play by changing the data source. So we only look at arm level data, for example, and then you can see that RevMan only pulls in the arm data that's available. So that's pretty exciting. We can also look at the other reviews analysis that we defined. So this analysis, which is a narrower analysis, includes fewer results, which is probably expected. We can also see 1 or more exacerbations with the low dose excluded. So here we can see there were actually quite a few with low dose, and going back into the subgroup, we can see results are now subgrouped based on the covariate values. So that was a demo of the process. Hopefully you have a better understanding of how study-centric data works in RevMan, and hopefully it gives you a bit of confidence to go out and try the practical exercise and to start using this for your review, because we're really looking forward to hear your feedback after you've tried it out. So I'm going to just share my slides here, because we also have some resources to share. Let's look at this. Yes, so we know that this process is quite new. and there are quite a few changes. It's also really exciting, but we do have plenty of resources available for you to get started. So there's the study-centric data Cochrane training portal that we've linked to in the chat. We have RevMan knowledge base with YouTube tutorials, and we also have some news items, FAQs, and other social promotion. And also, if you do have any questions as you're starting to use this, you can, if you don't find any answers in the knowledge base, contact support@cochrane.org to get help. And so we already have had an initial introduction webinar, which you can go back and watch the recording for. Today is the methods and practical application webinar. So if you want to rewatch it, that will be available soon. We are going to supply training and resources for trainers, which means that they can then teach all of the authors how to use this. And we'll also have workshops at the colloquium, as well as we'll be working on making sure Cochrane Interactive Learning stays up to date with study-centric data. So that's all in progress.